Dale Sky Jones talking to us from Oakland, California, with Oaksterdam. And, you know, it's one thing to have cannabis, but it's another thing to know what to do with the flower. And as we know, the government always says smoke it. And that is clearly not the only way people use cannabis. So we've asked Dale to go through this. She's going to, again, Oaksterdam does a lot of classes on this stuff. And as you've seen some of the commercials for Oaksterdam. But she'll go through it to give you people an idea more of you know, different ways to use it, cautions to use, tips about it. But I don't want to take any of your time. Go for it. She's going to share the screen and we'll have some PowerPoint.
Well, thank you, Mary Lynn. And I do want to wish you and all of the amazing folks in your organization a very happy 25 years. Oaksterdam and Patients Out of Time, I feel like we grew up together. We got into a little trouble, but we are all the wiser for it. And I'm absolutely grateful to have really grown up in the cannabis movement alongside you. And many, many blessings to you and yours. So I just wanted to start with that and welcome to Oaksterdam University. You are now in class with me, Dale Sky Jones, and let's go ahead and jump right in. I did want to just focus on a couple of key definitions. I'm pretty sure most of you are familiar with ingestion and inhalation, but I did want to briefly touch on the difference between combustion and vaporization. Combustion, you set fire to something, there is smoke, there is ash. That is often where the carcinogens come from. And depending on how you inhale, for instance, a short pipe, those are going right down your throat. You're also cooking the back of your throat a little bit if you are inhaling that lighter and also that lighter fluid over a long period of time. It's not just the cannabis that you're ingesting. And so combustion brings along with it another host of issues where vaporization heats up the cannabinoids, the terpenes, the flavonoids, just enough to reach boiling point or exceed boiling point, but not hot enough to combust the plant matter. And so in theory, vaporization gives you all the benefits of cannabis, of inhalation of the cannabinoids without the deleterious effects. But I do want to caution folks that that is based on studies of the whole flower with a volcano, which is a brand that has been shown to be, well, it's been built to be a medical device. And so it's certainly a concern to see pens coming out, oftentimes made with cheap metals or using other cutting agents in order to increase the viscosity to make what's inside the chamber a little bit more viscous. So the biggest difference here in inhalation is whether you are combusting or vaporizing the plant matter. The other one I want to point out is decarboxylation. Now, there are tremendous benefits to simply juicing the plant. You can absolutely get tremendous benefits from the acidic versions of these cannabinoids pre-decarboxylation. It will not get you high. And this is why we recommend that when you cook things like butter, that you heat it up at least to 315 degrees, which is the boiling point for THC. We actually recommend you go to 350 to get a fuller spectrum of the cannabinoids. But that decarboxylation, that heating up, is what converts THCA, the acid, into the, well, famous, infamous delta-9 THC that folks enjoy both medicinally and also for euphoria. You know, we often consume lots of different drugs to just feel good. And as long as you're doing this in moderation, nothing wrong with that. All right, so let's go ahead and jump in. I want to point out that hemp and cannabis are actually the same plant. It's not even just that they're sisters, they're twins. Federal law defines hemp as 3% or less THC, but this is arbitrary. This is a human line that we've drawn to say that anything above that is quote unquote dangerous, and Schedule 1, where hemp can be used for food, fuel, and fiber. Although we managed to screw that up too as Americans, it was illegal to even grow hemp here. Although we finally fixed that with the last farm bill, it's still extraordinarily difficult to navigate the regulatory schemes. And we do have a class on CBD and hemp at Oaksterdam if you'd like to learn more about the regulations around deriving CBD from hemp. But traditionally, we have not grown these hemp plants for high CBD content. We've actually been really growing them just for their stalks. And so every state does have its own hemp law, so make sure that you're checking into that. So plants can be genetically hemp, but test above 0.3%. That's often called hot. And plants, and this is important, can also be bred from medicinal varieties. And this is where you're often going to get some of the best full spectrum CBD derivations. The problem is the growers have also not been cultivating cannabis for CBD until recently. We used to only be able to measure the medicinal quality, well, by testing it, how high. And it wasn't until the late aughts, right around 2007, that Dr. Todd McArea and the Medical Cannabis Association started talking about, hey, we should be testing this. And that's when they realized that some of the varieties that, well, adult consumers perhaps did not appreciate were exactly the varieties that medical patients required. And so I would strongly recommend that you look into some of the differences between them. It's also important to realize that these days, the medical varieties of CBD derived from, medicinal cannabis are much more highly regulated than CBD derived from hemp. Now, I keep talking about hemp and medicinal cannabis right after telling you that they are the same thing. I just want to take an example from dog breeding. You can see a lot of different varieties, sizes, temperaments of your puppies, your dogs, dogs that you've known, and they're genetically similar and from the same species, but they're bred in different ways. And this could be the same as the cultivars that you are familiar with in cannabis plants. And so cannabis and hemp are genetically the same, but they're bred in different ways for different reasons. I also want to point out why I'm pointing out the difference between CBD derived from a regulated source versus unregulated. The source really does matter because hemp is a bioaccumulator. That means it sucks up all those bad things out of the soil. Now, this is why farmers plant hemp. In that 7th year, your field-lying fallow was not no plants, it was actually hemp plants because it returned vital nutrients to the soil and sucked out a lot of those negative things. In fact, it's been experimented with in Japan in Fukushima. Prayers to them. They had an earthquake in the last 24 hours. Oh. Also, it's been used at Chernobyl, and it's been proving to reclaim the soil even from things as nasty as radiation. And so it is a powerful bioaccumulator that can be used to recover our land and our farms and our soil from what we've been doing to it with commercial agriculture. But beware, as a patient, as a consumer, that oftentimes the hemp that people are using to derive CBD was never meant for human consumption. And we're now finding it on the internet for sale. And folks are giving it to their children because they're sick and they live in a place where it's not legal. And then their child is getting more sick. And so it's super important to know your source. And it's just another reason to legalize, decriminalize, deschedule, because as long as this substance is illegal, people are going to seek out more dangerous substances in order to acquire what they need, what they want, what they desire, what they have to save themselves or someone that they love. So methods of ingestion, how are we going to consume this? So inhalation, that's the popular one, of course, the one that most of us probably grew up with if you are a woman of a certain age in your mid 40s. But the reality is a lot of folks that grow up, the 20 somethings have been avid cannabis connoisseurs without ever having smoked a joint. So let that sink in. You're welcome. So joints and pre-rolls, ground cannabis flower rolled into some type of cigarette paper. I do want to point out that blunts do not have the safety profile as joints. Tobacco is bad, okay? So please do not wrap your cannabis in it. It barely can counteract some of the negative effects caused by tobacco. So just don't do it. Pipes, I've already mentioned at the top, are not your best bet. You're cooking not only your lungs and the back of your throat, especially, which is not good for your cells in there, but you're also more likely to inhale the ash, the tar, and potentially you're inhaling the metal that you're cooking, depending on the type of pipe. Smoking, of course, will always gift a little to the cannabis gods, but it turns out no matter how you consume your cannabis, a little bit is gifted to the gods. If you consume using a bong, for instance, your THC tends to stick to the glass. So talking about wraps and blunt wraps, we know blunt wraps are bad, but a lot of the other wrapping paper you also want to look out for. Just avoid the types of wrapping paper that are flavored, colored, and we've also discovered that the cellulose-based clear papers that you feel should be clean are actually the most likely to contain contaminants. So make sure that you are consuming the cleanest paper you can. And with respect to the water pipes and carbs, as I mentioned, you do lose a little bit to sticking to the glass. I'll point out as well, if you enjoy your cannabis in a hot tea, that is why adding just a touch of some type of lipid or fat, whether that is milk or butter or soy, whatever it is you need to just a little dab will do ya. But that way the cannabinoids can melt into that fat rather than sticking to the side of your glass. So bongs, the biggest danger I would like to warn you about is what grows in it when you leave it to the side and then continue to use it over and over again. You need to clean your bongs. It's not a bad way, especially if it helps you prevent coughing, because oftentimes, well, the reality is that coughing does more damage to your lungs than in some cases the ingestion method. So if there's a certain ingestion method that is quote unquote safer, but it makes you cough constantly, it's not safer for you. And this is just a tip as a harm reduction technique. So some people prefer bongs because it introduces more moisture, it cools it down, you can ice it, that's all great. But especially if you have any type of lung condition or if you have a history, especially with COVID right now, you just want to really make sure that you have super clean water that you are inhaling into your lungs, that you are not passing it around and then letting something grow. All right. Inhalation with vaporization. This is the ever famous volcano that we can always recommend. It is expensive, but in the long run, the control that you have over the temperature of your medicine and the ability to save a little for later, take it with you, so to speak, in the bag, and just know that you can trust that it is a medical grade device. I don't work for Volcano. I've just been a fan for over a decade. There are other companies, I believe PAX has several that are medical grade devices. You just want to be concerned with the quality of metal and plastics that are being used, because once you get up to high temperatures, you will have off-gassing, and you are inhaling that and you are mainlining that to your brain. So with vaporization, you're converting the cannabinoids into a vapor with the application of heat, as I mentioned at the beginning. And there are no safety studies with respect to the pens. So I did bring a few samples. If we get time at the very end, I can show you what a few of these happen to look like. But I just want to mention that the safety studies that are currently out there with respect to vaporization, which do show that patients experience the same effect as they do with smoking, so you're not losing any efficacy, that has not been tested with respect to the pens that you can purchase now. The safety profile is just simply not the same. The concern, aside from the plastics and metals that are in the pen, is the cutting agents, as I mentioned. Many of these things, even if they're food safe, please realize that food safe means you can ingest them, swallow them, and the cast iron stomach that most of us have, the liver first pass effect will reduce, if not remove, a lot of the dangerous elements. So safe for consumption means safe to eat it and swallow it. What we're doing is applying heat. We're inhaling it and it is being metabolized by our bloodstream versus our liver. And so the effects, not only of heating what would normally be food safe, converts to a different chemical. For instance, there's one commonly used in vape pens that we discovered converts to formaldehyde at high temperatures. And that is what you're inhaling. And the bloodstream, it does cross the blood-brain barrier, which means if you're pregnant or your own brain, no bueno. Again, know your source. So vaping versus smoking, in a nutshell, it is, oh, look at that. I already had a slide for it. So I talked about it at the top with respect to the difference between vaping and smoking. So I'm just going to move on. Now, topical and transdermal. We have topicals, lotions, balms, oils, the things that you rub on your skin. Now, transdermal is different, and there are some transdermal patches. When you hear transdermal, it's through the skin. That should also set off a bell for you that you may pop a positive on a drug test in a transdermal situation. So if you have a THC transdermal patch, you might be concerned. However, there have been no indications with many, many years of experimentation of a simple topical triggering a positive in a drug test. It also just simply won't get you high. And so topicals are a great way to start with someone who's concerned about cannabis as medicine. If you need to introduce your dear Aunt Betty, just try rubbing it on her arthritis for a few days and see how that helps. And it does often take a few days and sometimes even a few weeks to really start to feel full effects, especially if you're talking about years long pain and inflammation. However, applying it many times a day for many days in a row, it's really hard to not feel the effects. So there are growing uses of topical products, inflammation, joint issues, as I mentioned. It's also in the last few years being introduced to improve sexual health. It definitely heightens erogenous sensitivity. It increases blood flow. Your veins expand, your capillaries expand a little bit. It's also one of my favorite athletic enhancing drugs. I'm waiting for somebody to identify cannabis as actually improving people's performance in athletics. So let's talk about sublinguals. Sublingual, under the tongue. When the cannabis product is absorbed into the mucous membranes of the mouth, this is also processed through your bloodstream, similar to inhalation, although it does take a little bit longer than inhalation to feel the effects. Sometimes because you're waiting for instance, the lozenge to melt and fully absorb into the mucus lining. So it takes a little longer for onset than smoking or vaporizing. Now you've got lozenges, breath strips, tinctures, lots of different options. And sublingual ingestion does result in faster cannabinoid absorption as compared to edibles, where you're just intentionally swallowing what you're eating. But please be aware that even though a sublingual, when kept in the mouth and absorbed through the bloodstream, if you accidentally swallow it, now it's an edible. So we'll talk about what happens in just a moment there, because it is really important to realize that when you ingest orally, when you swallow THC cannabis products, you need to start with a low dose. And it's always good to start low and slow, if for nothing else, to avoid a negative result, something that A little bit is euphoria, can quickly become dysphoria, and you just wasted your weed. And so just low and slow, people. It's good for your pocketbook. It's good for your health. But especially when you're eating cannabis. Oral ingestion is different for everyone, and it's also even different for you, depending on how much sleep you got, depending on what you ate. If you ate a very fatty meal just before you eat your edible, it's going to take longer for that edible to take effect, but it may also last longer as a result. So we'll talk about why you get a different effect with your liver here shortly. The next ingestion method that I'd like to point out is suppositories. So products traditionally used rectally, and now you're finding more and more, as I mentioned, vaginal suppositories. This type of ingestion is a great fit for cancer patients and people that just have cyclic vomiting syndromes that are often triggered from different medications or treatments, chemotherapy, radiation. Someone like me who's just lucky enough to be born with it, you can't hold down a pill and you can't throw up smoke. You also can't throw up a suppository. And so vaporizing, smoking, and suppositories are often the only way to ingest medicine for individuals that just simply cannot keep food down, or in many cases, water either. So onset and duration. The basics of administration briefly: onset, duration. What we're talking about here is the effect of cannabis is different depending on how you consume. And so we talked about the different orifices that you might bring in your cannabinoids. Inhalation has a very rapid onset effect, usually almost immediate, but it also doesn't last very long, oftentimes only 20 minutes up to, on the outside, about an hour, sometimes two. So the good news about inhalation is that it's really easy to titrate. You know how you feel right away. You know when to put it down. You know when to pick it back up again. And if you've ever wandered off and then, oh, look at that, I have half a joint in there. Well, that was your body basically titrating. You were good. You wandered off. You got some stuff done. You took a nap, whatever it was you were supposed to be doing. And then when it was time for more, your body said, oh, where did that go? Here it is. Oral, delayed onset, longer overall duration of effects, and a greater possibility of dysphoric effects, including paranoia. And then transdermal, the cannabinoids are lipid soluble. They're absorbed by fat. It does not necessarily, though, result in a higher degree of cannabinoids entering the bloodstream. So pharmacokinetics of cannabis, and pharmacokinetics is something that you will hear and read about in any pharmacology class. And so we're applying it to cannabinoids: absorption, distribution, metabolization, and elimination. And I'm going to move a little bit quickly through here because I want to make sure that I absolutely get to the end. But in effect, cannabinoids have to be absorbed through one of the layers that keep the rest of the world out and your body in. So whether that's through your skin or your lungs. All right. Oral ingestion produces a much different effect in your blood profile with respect to THC as well than smoking. So with smoking, as I said, it peaks rapidly and then quickly declines. With edibles, it's a gradual rise with a milder plateau hours later before declining. And it is the first pass effect that is responsible for edibles making you feel, well, in some cases, like you're tripping. It's the first pass effect that only happens when you swallow. The concentration is significantly reduced or otherwise modified by the liver. And the liver converts the THCA, the precursor, into a slightly different cannabinoid than your bloodstream. So your bloodstream converts THCA into delta-9 THC, but your liver converts it to 11-hydroxy THC. And 11-hydroxy THC is more psychoactive. This is why you can have some edibles and feel like you're tripping, but it doesn't matter how much you smoke, you cannot get that same effect. This is why it's the first pass effect. And like I said, sublinguals normally avoid the first pass effect if you do it right, because it's the lining in the mucus, the lining of your mouth that's absorbing, not the mucus, but the mucus membrane in the lining of your mouth that's absorbing. Although yes, lots of mucus usually when you're eating edibles, you drool a lot. And so even some of that drool, so to speak, that you're swallowing, the saliva, could give you a little bit of that first pass effect. However, there's no indication that through inhalation suppositories or topical that this ever happens. So that first pass effect, that THC change, as I mentioned, that is what 11-hydroxy-THC looks like in chemical form, 11-OH-THC. And that oral ingestion produces greater quantities than does inhalation. Now, it's not just elevated feelings of euphoria that you can get from too many edibles, it's also dysphoria. Sometimes that psychoactivity is not welcome. And we just simply recommend that you lay down, try to keep yourself safe. This is not the time to drive or go somewhere. Drink water, but not too much water. Try to take a nap. And the best advice, if you have a dysphoric reaction to too much THC, is actually CBD. Try to have some CBD product on hand, because CBD mitigates the psychoactive effects of THC. So even just a quick CBD joint, or if you have a CBD edible, just try to keep some CBD at hand. It's about ratio. You can have THC and CBD and still not really feel high, so to speak, from the THC because of the ratio. As long as you have more CBD than THC, it mitigates that psychoactive effect very well. And this is what happens to your blood. And I'm pointing this out for anybody that has to do with testing when it comes to safety. I'm thinking of those roadside breathalyzers or blood tests, that the reality is what we're testing is not measuring ability or capability, certainly not to drive or operate heavy machinery. Now, we as patients know that the reality is that oftentimes it's the cannabis that helps us perform better. If you're sick, if you're ill, cannabis does not make you high. It makes you better, makes you well, it makes you more able to function. But this is really specific, regardless of whether or not you're a patient, for law enforcement who are trying to understand how to identify someone who is driving under the influence, someone who is quote unquote intoxicated. And right here, you'll see the blood levels of THC, the metabolite. The smoked has a really high peak. You can see the red, no matter whether it is the THC or the THC-COH smoked, THC shows up on these tests, but it tends to disappear rather quickly when it's inhaled. That is the point. If you see that tiny little line all the way across the bottom there, it's like a dark blue line, barely peaks around 4 hours. That is orally ingested THC. So what concerns me as a mother of three, as a driver on our roads, is not people that just smoked a joint and get behind the wheel. It's the folks that just ate too many brownies and got behind the wheel. And yet when you measure it, the person that had too many brownies, the one that is having a larger than normal psychoactive reaction to the 11-hydroxy-THC that their liver just converted in the first pass effect, not even a blip on the blood test. Not even a blip. So we really have to be careful as we are forming policy. The other first pass effect I want to point out, especially for patients that are on other medications, is the CBD change that happens with the first pass effect. It's not just THC. And CBD is converted into other metabolites in the liver as well. CBD inhibits the production of certain liver enzymes. And in this family of enzymes, anyone that is told do not eat grapefruit within 2 hours of taking this medication, do not consume CBD within 2 hours of taking that medication. I realize that this is very layman but it's really the best I can do right now until the FDA is willing to legalize research. So it seems that CBD, that potent inhibitor of these enzymes, is very similar to the same inhibitor that is found in grapefruit. So just look for those warnings for grapefruit. Research on these effects is mixed. We need to legalize and deschedule marijuana, cannabis, in order to research drug interactions and drug effects. So balancing CBD and pharmaceuticals, they can sometimes lead to toxic effects in certain situations. Think of THC as an on switch and CBD as an off switch. Cannabinoids do different things in your body, and it's not that independently that they are dangerous. It's what they can do with respect to the uptake of the other drugs that you're on. And so, for instance, something that is high in CBD can increase the amount of absorption of a drug you're taking, or greatly decrease the amount, more likely, of the drug that you're taking, not providing enough. Now, what's also interesting, though, is folks that start a medical cannabis program for trying to wean themselves off of pharmaceuticals, oftentimes they find a replacement. Now, I'm not going to play doctor, nor should you unless you are one. It's not, again, the cannabis I'm worried about, it's the pharmaceuticals. That stopping the taking of normal pharmaceuticals as your doctor prescribes can be harmful. So you always want to do this under your doctor's supervision. But there are countless testimonials and finally some research around the fact that you can reduce the amount of other pharmaceuticals that you might have to take in starting a cannabis regimen. Also, anything that I'm telling you also goes for your pets. Mammals also have endocannabinoid systems. In fact, it turns out that every living critter has an endocannabinoid system. Even the oldest living critter, the hydra, has an endocannabinoid system remarkably similar to our own. So know your dose, titration. Cannabinoids effects are very dose specific. It's also very specific to you as a patient, as a consumer. And so it's often, if you're trying to go with edibles, it's great to use them in batches, because you know if you have 12 cookies, after you experiment with a quarter and then a half and then 3/4 and then a whole of that first cookie, you have a pretty good idea how the other 11 cookies are going to affect you. It's also the benefit to sticking with certain brands that you like, that you suddenly realize, okay, this works for me. But understanding your dose is important, and also understanding that time of day, other meals, the amount of sleep, the other drugs you might be taking, and especially alcohol, can all affect the way cannabis affects you. There is a synergistic effect also with opiates. Understanding your dosing will help you with achieving that desired effect without wasting the product, which can get expensive. And not knowing can absolutely lead to a bad time. We do recommend, especially if you do not visit a regular doctor very often, the biggest concern for me is a delay of diagnosis, that you are consuming cannabis for one reason, and because it works across multiple systems and helps with many symptoms, you may not notice there's something else going on. And so it's important to keep getting those yearly checkups. It's important to make sure that you're getting sufficient vitamin D3, and it's important to take a break every once in a while. Now, I'm not necessarily talking to somebody who can't function without their medicine, but for the rest of us, just taking 2 or 3 days or a week off will help lower tolerance, and it will also just help reset your system. There are some folks that have experienced something called marijuana hyperemesis. It is usually the symptoms that people recognize as uncontrollable vomiting and a strong desire for very hot showers. That is also a side effect of cyclic vomiting syndrome. And in some cases, too much cannabis can trigger this, because people hear, oh, well, cannabis helps nausea, so let me have some more. And then they wind up in the emergency room hooked up to IVs, wishing they could have a hot shower. Just stop. That's right, just stop. 2 weeks, stop consuming cannabis. And that usually seems to reset the problem if you come across it. The timing and bioavailability of doses is different depending on how you consume. So I'll just go ahead and leave this up for just a moment so that you compare not just the time to effect and duration of effects, as we've already talked about, but the bioavailability. Inhalation does give you tremendous bioavailability. It is how humans have been consuming medicine for tens of thousands of years, dropping herbs onto the fire and inhaling them, or hot rocks. I'm pretty sure we've been vaporizing for a long time too. Children, especially children with seizures, the dose does need to be specific, carefully measured, and carefully sourced. Again, make sure you know where you're getting it from. There have been several recent studies that indicate a 19-to-1 ratio of CBD to THC can reduce children's seizures with 2 daily doses. All children experienced a reduction in their seizures, most by more than 50%. It is important to realize that when it comes to dosing, oftentimes children require a higher dose. It doesn't mean that you are getting them more high with more THC. The metabolism is extraordinarily different for these little ones. With smoking and vaping, just a small amount. Dabbing is another form of smoking. You do not want to hold in the dab. You also want to be aware of your surroundings, especially if it's your first dab. The most dangerous thing is not consuming cannabis. It's cracking your head on something after you consume cannabis and then pass out. And we've seen this most often with dabbing. It is just a tremendous amount of cannabinoids in a short amount of time. And you just want to squat or sit. If you do feel dizzy, it's hard to pass out from a squat or sit position. And if you do, it's just not that far to fall. So you're less likely to hurt yourself. Also, it's good to wait 5 or 10 minutes in between dabs. Just settle down, cowboy, and take your time. Make sure you feel the effects before you have another. And once you find your limit, just don't go past it. Again, it's drug abuse. You're wasting your cannabis if you have so much that it doesn't feel good. Edible dosing is quite a bit trickier, and because you do have a different metabolism, it's going to affect you differently than anybody else that is consuming the exact same product as you. It's also why doctors have had such a hard time saying, here, take 2 and call me in the morning, because those 2 are going to hit each of you differently. For most people, 5 to 10 milligrams is an effective starting dose. Individually, more body mass generally needs more THC. Older and smaller people, adults, tend to be more sensitive, although children, as little people, tend to require a higher dose. 2.5 milligrams is usually the minimum psychoactive, so start there, and then you can slowly scale up. Dosing sublinguals and suppositories are also kind of tricky. With tinctures, you want to start with 1 drop. If the potency is labeled, you're able to dose it more like an edible. With suppositories, you just want to follow the manufacturer's recommendations for dosing. Suppositories have an onset that are very similar to sublinguals, but it is a little trickier to dose those as well. So there's nothing wrong with cutting the suppository in half and starting there, or even a quarter, and starting there before you do any more. Again, low and slow, just like any other method. So topicals and transdermal dosing, pretty much impossible to overdo a topical other than just getting super slick and slippery and oily and greasy if you just put on too much. The products are unlikely to produce a psychoactive effect. Very little THC, if any, passes through to your bloodstream, and they should not be detectable in a drug test. Keep in mind that anecdotes are not science. However, up until recently, testimonials were how we figured things out. And in many cases, when you have prohibition, testimonials are all you have. Once you start to combine thousands and even tens of thousands, you do start to have a story to tell. Isolate versus full spectrum dosing. there have been a multitude of studies on the full spectrum of cannabis, and the 2015 Israel study compared a CBD isolate to a full spectrum. It is important to realize, and this is where the FDA is going to be important to pharmaceuticalize isolates, because they do only deal in single molecule drugs. This is why we have compound pharmacies. It is not the FDA's purview to manage whole plant medicines. This is why we want to just deschedule and bring it over to another regulatory regime. But it is in fact the whole plant medicine that seems to have the best medicinal effects. When we just pulled CBD alone, for instance, in a Huntington study, there was a bell-shaped curve effect where it was extraordinarily difficult to target the right amount when it was just CBD and get a benefit. Where when it was a full spectrum with CBD, it was impossible to miss. There was some amount of benefit regardless of the amount given. So full spectrum has provided a clear correlation between the dose and the anti-inflammatory effects. But more than that, if you start to look at some of the cancer studies, you'll also note that it may not just be the cannabinoids that are having the beneficial effects. It may in fact be the flavonoids. And so it's important to really consider cannabis as a whole plant medicine. And remember that we can walk and chew gum at the same time and continue this medical research, and also not criminalize adults and other law-abiding citizens as we go. So that whole plant, full spectrum, when CBD is removed from the other 100 plus cannabinoids, the benefits for pain and inflammation are also no longer dose dependent. And in many cases, consuming terpenes and cannabinoids in concert together are actually going to increase the therapeutic effect. So there are many folks that would recommend that you eat things like mango when you consume cannabis. Now, keep in mind that these flavonoids, these terpenes, are found in many foods that we commonly consume. So you can absolutely buoy those effects. Now, there's also a paradoxical effect with cannabinoids that sometimes a little bit makes you feel good and a lot makes you feel bad. And so low doses sometimes will also have just a different, if not even opposite effect as the higher doses will. CBD, as I mentioned earlier, if you're having a bad effect from THC, CBD can be used as a non-psychoactive mitigation of the bad effect of THC that you might be experiencing. But also low doses of CBD, if it's dosed correctly, low doses can wake you up and high doses can put you to sleep. Caffeine also has a similar paradoxical effect. So it's also not just dose dependent, sometimes it's also environment dependent. Some of you may recall set and setting. If you just want to, this is one of my favorite settings to go to in my mind. That was a painting by George Fuller, a cancer patient that my husband, Jeff Jones, helped before he died. And he left us many of his paintings that helped me with my set and setting, frankly. So it is possible to experience one type of effect in certain circumstances and the opposite in others. Some cannabinoids also affect paradoxically, for instance, THC and THCV. THC tends to stimulate appetite, where THCV tends to suppress appetite and also suppresses nausea and vomiting. So the moral of the story, start low and go slow, waste not. That the whole plant derived products are absolutely associated with more beneficial effects. And this is across a multitude of scientific studies and research, as well as testimonial. And it is most important to advocate to deschedule cannabis, deschedule THC and CBD, so that we can decriminalize, take the teeth out of the criminality, take it off of Schedule 1 and recognize the medical benefits. And most importantly, legalize research, legalize access for patients regardless of where they live. And finally, I just wanted to do a little OU loves Patients Out of Time. And I love you guys. I appreciate you. Thank you so much for your time and attention. That concludes my formal presentation.
Thank you so much, Dale. Wonderful to hear. And again, I hope people appreciated the fact that it makes a difference how you use it and the safety precautions. And I think the edible is probably the biggest issue we have. I don't know how many people have gotten so sick because something tastes good and they have more, or they have cooking sessions where people are tasting different things all infused, and it's like, it's gonna knock you on your ass.
Indeed. And it is absolutely important, especially when you are, I personally, for me, edibles put me to sleep. So if that's the effect I'm going for, then fantastic. But if it's at any point during the day and I want to be effective or productive, I cannot consume edibles. CBD, THC, doesn't matter, it seems. But I've also learned that if I'm going to have something that is, for instance, the most delicious chocolate edible I've ever experienced in my life, and by the way, edible makers, it's not fair to make a bonbon and then tell me it's a 10X and I have to eat it in quarters. I just make sure that I have some other cookies on the side so that I have something else to satisfy the sweet tooth other than the edible. The other problem too is they feel like, oh, I don't feel it. So they're like, oh, let me have some more. Oh, I don't feel it. Here, have some more. Oh, I don't feel it. And then you're done for 18 hours. And good luck getting up for work in the morning.
Yeah, so with that being said, for many people, it is a good one to take at night, at bedtime, if they really do need something for sleep. I know for veterans, the transdermal patch has been really good for them for getting to bed at night. I think the only comment I wanted to make about the transdermal patches is a lot of times we'll advise people to put it on the wrist or maybe on the inside of the ankle, just because the blood supply is really good there, and it'll be absorbed.
And the skin
quickly.
is most thin.
Yeah. So
yeah.
I'm going to have to say thank you, and we're going to move on, showing a short little demonstration on some baking with cannabis.
Wonderful.
With Karen Lazarus. So thank you again, Dale. It's
thank
a pleasure,
you.
and
have a beautiful
obviously
afternoon.
We'll be working more. And happy 25th to Oaksterdam.
Thank you. Thank you. Yes, 25 years. We are excited to be still standing with you. Have a beautiful Sunday and happy Valentine's Day. And I'm excited to watch Karen. Thank you so much.
Right. And happy Valentine's Day to everybody here. Let's go to Karen Lazarus.
Hi, I'm Karen, owner of Sweet Mary Jane Bakery in Boulder, Colorado. We opened our doors 10 years ago and we intend to keep going. I want to thank you so much for joining us for the Patients Out of Time 25th anniversary. Today we're going to be making key lime truffles. These truffles are like little tiny key lime pies. These are a patient favorite. They've won many awards over the years. First place for Best Edible and first place for Patient's Choice at the Hemp Connoisseur THC Classic. So that is Lucy. She is the other owner of Sweet Mary Jane, and she is showing you the new caramel crunch popcorn. Today, we wanted to make key lime truffles. These have been a favorite of the Sweet Mary Jane Bakery for years. So I'm going to tell you what these ingredients are. So we're using white chocolate, heavy cream, a little bit of corn syrup, infused butter, and the butter has been infused with distillate, a little bit of sugar, and key lime oil. So to start, so we understand how our math works and how the dosing is, we're going to weigh a bowl, and that's what I'm doing here. So I've weighed that bowl, and then I write down the number of the empty bowl and just keep it aside until I understand what that ganache is going to weigh once it's been completed. So here I am heating up the heavy cream. And to this, I'm going to add the sugar. Here's the heavy cream being warmed. And once that starts to just get a little bit warmer, we're going to start to add the ingredients that I listed before. And we're going to add the corn syrup, the sugar, and let all of that warm up. And after you add each ingredient, make sure to stir it well. Okay, now that that is warmed up, we're going to add our white chocolate. And you don't want that to overheat because white chocolate seizes very easily. Okay, we can see it's starting to melt now, and that's just over a low heat. And there it is, all incorporated. Now the key lime oil is added. So I'm going to pour this ganache back into the bowl that you saw me weigh at the beginning. And you can pop this in the freezer for about 30 to 45 minutes, or if you want to take your time, you can put it in the fridge for a couple of hours. You just want it to get nice and firm, but still pliable. Okay, back on the scale. Take that number, subtract the weight of your bowl, and then you're going to divide by the number of pieces that you're going to make. Now, what we thought is, gee, this would be nice to make this very low dose so that rookies can enjoy and the pros can eat a few. So these are only going to be 2 milligrams each. We're making 24 of them with the recipe that we have. And so we're taking that ganache, rolling it into little balls, and then putting them into the graham cracker crumbs and covering them, making sure that all sides are evenly coated. I just wanted to tell you how I came up with my infusion for the butter. So the distillate that I'm using is 800 milligrams per gram. So I took a pound of butter, added those 800 milligrams, and it came out to be 25 milligrams per tablespoon of butter. So it's super easy to do. What you have to know, if you have access to distillate, look at what the percentage of THC is on there. So you'll take the volume of the distillate you'll be using in milligrams, and 1 gram equals 1,000 milligrams. So your amount of distillate times the percentage of your THC. So if say your gram is 860 milligrams, you're going to divide that number by the pieces your batch will yield. So if you have 1,000 milligrams times 0.86, that's 860 milligrams, you could make 100 cookies at 8.6 milligrams per piece. I hope that makes sense. I want to thank you for joining us at the Patients Out of Time 25th anniversary. I just want to say, if you don't have access to distillate and you do want to infuse butter, coconut oil, or sugar, you can find all those recipes in the Sweet Mary Jane cookbook. Thank you.
Hello. Thank you so much, Karen, for showing us a little something. And again, she's got her cookbook there.
Sweet Mary Jane.
Sweet Mary Jane, that people might want to look into for more recipes. We want to get in some more testimonials. We had so many come in, and it's been hard to fit them all in. But I want you to all hear from, you heard earlier from Ken Walsky, talked a little bit about the American Cannabis Nurses Association. The past president is Eloise Thiessen, and I'm going to have her she wanted to have a shout out for us.
Patients Out of Time was the first cannabis conference I ever attended back in 2014. And I had the great pleasure of meeting some of the most prominent physicians and scientists and nurses in the cannabis industry at that time. I've continued to have great relationships and friendships ever since then. and have even gone on to become the president of the American Cannabis Nurses Association. I'm forever grateful for the work of Patients Out of Time, and particularly Lynn Mathre, who has been an inspiration and role model for me in my cannabis nursing career. I am excited to celebrate the 25th anniversary with them and attend on February 13th and 14th, and I hope all of you will join me as well.
And thank you, Eloise. Next person we're going to check in with is Ethan Russo. He's been, I think most folks know him. He's probably one of the best physician researchers in cannabis. I've known him from the beginning. We wrote our book, The Women in Cannabis, with Ethan, myself, and Melanie Dreyer. Anyway, we're going to have a few words from Ethan Russo now.
Well, hello, everybody. I'd like to wish Patients Out of Time a happy birthday or anniversary, whatever we're calling it. I've been associated with the organization for many years. We go clear back to the end of the 90s when this book came out, Mary Lynn's book. I was fortunate to be visited by Mary Lynn and Al and the Golden Retrievers at her home in Montana about that time. And then I was involved in the early conferences in Iowa and Virginia, on and on, coming up closer to the modern day. It's been a great organization. I've had wonderful meetings and liaisons with people there, and I hope there are many happy returns. Best wishes.
And thank you, Ethan. Next, we might as well go up to Canada. Mark Ware, he caught our first conference when it was in Iowa on the, we were able to simulcast it to 10 locations at our very first conference. Mark Ware picked it up and got interested, and he actually started the Canadian Consortium for the Investigation of Cannabinoids. Anyway, let's hear from Mark.
Hi, Mary Lynn and the Patients Out of Time family. My name is Dr. Mark Ware, and I have a very long and very, very happy history with Patients Out of Time. I remember attending the first international Patients Out of Time meeting when we were able to connect from Montreal, Canada, to the meeting, which I don't even recall where it was being held, somewhere in the Midwest. There were 3 of us in a room for 3 days in Montreal, participating in the meeting, listening to all the presentations, and this is back in 2000. So 20 years plus have gone by, a lot of water under the bridge, some amazing advances in cannabis science, some amazing advances in cannabis medicine. We've seen new products actually become approved and available. We've seen new data, new science. There's still a long way to go, and I continue to remain committed to and involved in that exercise as I've now transitioned from McGill University to working as Chief Medical Officer for Canopy Growth Corporation. It remains one of the most exciting areas of medicine, of neuroscience, and I think there are still, unfortunately, rather too many people out there who either don't know much or know enough about cannabis, not to mention people who continue to suffer needlessly with debilitating symptoms and conditions which could be in part relieved or supported through the use of cannabis as a therapy. We have a long way to go, but we've come a long way from where we were. So my thanks to Mary Lynn, to all the Patients Out of Time team. I'm sorry I can't be with you in person on this occasion. Good luck, keep up the good work, and keep loving your hearts and stay safe. Bye-bye for now.
And that was Mark from Canada. And we want to try to squeeze in a few more here. The last one we want next to go to John Malenka. He's with United Patients Group. First met him in 2012. United Patients Group has worked great with Patients Out of Time.
Hey everybody, John Malenka here with the United Patients Group, and I just want to send a big warm congratulations to you, Mary Lynn and Al, for 25 years of Patients Out of Time, educating not only medical professionals, patients, and beyond about the benefits of this plant. And I just want to say thank you. You were a pioneer in this industry. You were a stepping stone for Corinne and I when we jumped into this industry back in 2011. We've learned so much from you both, but also from all the speakers and the professionals and the medical professionals that you have brought on to educate us. And so I want to thank you so much for everything you've done. We've not only been colleagues, but friends. Since then, we've supported each other. We've been together at our conferences. You've spoken there, but we've been at your California conference, your Portland, Oregon conference. Where else? Colorado, Florida, up to New Jersey and everywhere in between. And I look forward to supporting and working together for another 25 years. And so congratulations. Keep doing what you're doing. It not only means a lot to us, but it means a lot to many of us in this industry as well. So congratulations and blessings to you both. And we'll see you soon. Bye-bye.
One last testimonial here from Patricia Fry, Dr. Fry. She's coming to us from Maryland, a physician who's with the Society of Cannabis Clinicians.
In 2016, just about a year into doing medical cannabis telemedicine evaluations for California patients and still not knowing a whole lot more than what the patients were teaching me and what I could glean from reading journal articles on PubMed, I attended my very first medical cannabis conference. And it was my good fortune for it to have been a Patients Out of Time conference. And what an awesome experience it was, not just being able to listen to these leading experts in research and in clinical medicine, but actually having the opportunity to sit down with some of these people and ask questions. And what a surprise it was to learn that Patients Out of Time was headquartered just about an hour and a half down the road from my home in Madison, Virginia. Talk about small world. So for this 25th anniversary celebration, I just want to send a hearty congratulations to Mary Lynn and her team. I want to thank them for all the hard work that they've done over the years, advocating for our patients' rights to have legal access to this pharmacy and a flower, and for educating us healthcare providers on both the art and the science of cannabis medicine. Congratulations, and keep up the good work.
And we've got one short little video here from Deb Kimless. It seems silly. She's poolside as we're out here in Charlottesville in a snow ice storm. But here's Deb Kimless.
Dr. Deb.
Dr. Deb.
Hi, I'm Deb Kimless. Congratulations, Mary Lynn and the entire Patients Out of Time team for reaching an incredible milestone of 25 years of advocacy and education. When I began investigating medical cannabis some 9 years ago, there were very few legitimate resources. When I learned of Patients Out of Time, I excitedly attended the conferences, pen in hand, along with my nerdy notebook, and feverishly took notes. But more than the knowledge, which was rich and deep, these conferences were a community, a safe place for everyone, regardless of degree or level of education or occupation, to exchange information, ask questions, and even break bread together. The very same people from whom I took notes have now become colleagues and friends. So thank you very much for persevering and taking on this noble cause of being the patient ombudsman. Happy anniversary, and here's to another 25 years.
Well, this is bringing us to the close. We got one more testimony that we'll get to, but we just want to make sure we thank everybody out there, all the speakers that joined us, all those who joined online. Wish we could see you. I like those TV shows when they've got everybody's face up there behind us. Maybe one day we'll get to that as well. But this serves us well. Please remember, think about it now, mark your calendars, May 20 to 21. It'll be the 14th National Clinical Conference on Cannabis Therapeutics. The theme is State of the Science. And we're just literally going to catch people up to what we know now. It's amazing. We've got an amazing faculty that's coming. It will be virtual. We clearly hope we'll be with you live in 2022, because that's probably the signature thing about Patients Out of Time is the networking at our conferences, of letting people communicate with each other. But again, we appreciate everything. Michael, have him take over, but I want people, if you can point out, I don't know if you can see his shirt, you need to be someone who understands the Roman numerals, but Michael just likes to celebrate 420 in his own way, as usual.
My favorite shirt, I got to tell you.
So Michael, why don't you go ahead and, again, we've got our sponsors to be so thankful for.
Well, we would like to thank our board. We want to thank our sponsors, Dr. Bronner. We want to thank Bovida. We want to thank Undo. We want to thank Healer, and I've just lost one in the process. Oaksterdam University, thank you so very much, you know?
Thank you,
Who
Dan.
says there's no short-term effect on memory with cannabis, you know? That is an adverse effect. But thank each and every one of you. Thank those of you who participated in the raffle, and congratulations to our several winners. Looking forward to doing this. Patients out of time is always put patients first. We will continue to do so. I've got to admit, we learned a lot out of this particular conference. They're
Bye,
full
everyone,
spectrum.
and thank you so much.
Goodbye, and thank you all. Absolutely. Look forward to seeing you again in your future.
And Cola says thank you, too.
She does?
Even if she
Oh, she
slept through
does.
it.
Yeah. Thanks, guys. Happy Valentine's Day, everyone.